Yes, so we are talking about the dual system, public and private sectors of ensuring comprehensive medical service. This is basically, I'm talking about the UAE healthcare sector. Here in which government oversight, there are different regulation bodies we are having. Yes, so we are talking about the dual system, public and private sectors of ensuring comprehensive medical service. This is basically, I'm talking about the UAE healthcare sector. Here in which government oversight, there are different regulation bodies we are having. Yes, so we are talking about the first public sectors of actually comprehensive legal service. This is basically I'm talking about the legal care system. Here is government oversight. There are different regulation bodies we are having. Yes, we are talking about the first Sorry for the interruption, actually. It's difficult to just send to Rajkumar, sorry. Yeah, so I'm just starting my presentation. Thank you all. So we are talking about the healthcare system structure in the UAE, dual system, public and private sectors, in which there are different regulatory bodies, MOHAB, Ministry of Health, Department of Health, the DHA, and then DOH, which is based upon the emirate level management. Total hospitals are 116, in which public are 39.4%, private is 60.6%. Hospital distribution, Abu Dhabi 66 hospitals, 88.5%. Dubai comes 52 hospital, Sharjah, Ras Al Khaimah, Fujairah contributing to a diverse healthcare network. Bed occupancy rate is 2021, 54.4%, efficient resource utilization. Healthcare expenditure is 4% of the GDP, reflecting strong commitment. Quality, accessibility, investment in medical technology, enhancing service quality. Private partnership is there, and strengthening healthcare delivery. Life expectancy is 78.5 years due to early diagnosis and the preventive care. So these are the sources from, basically we are having the regulatory bodies, so all the sources from the government regulatory bodies. So diverse and the skilled workforce, you know, the Dubai is a very much welcome market. So most of the people are the expatriates. So total healthcare professionals are approximately 100,000 registered professionals. Expatriate dependency is 70 to 80% of the workforce consists of the expatriates. Majority are the expatriates actually. Essential for meeting the demand across medical specialties, challenges and workforce sustainability. High reliance on foreign professionals, retention and sustainability concerns. Rising demand for specialized healthcare services due to population growth and chronic disease prevalence. Government initiatives and localization efforts are there. Increasing Emirati participation, national program for advanced skills, enhancing local expertise. Medical scholarship is also provided. Specialized training programs are also given to the Emirati professionals. Alignment with Vision 2021 and Vision 2030, developing a self-sufficient, high-standard healthcare system, reducing dependency on foreign labor through strategic investment, future outlook, investment in professional development and incentives, strengthening workforce sustainability, commitment to international standards, ensuring high-quality healthcare services. Basically, UAE is a very healthcare market, and it is inviting most of the expatriates from across the country. So, in and around of the Dubai, Abu Dhabi, Emirates, most of the doctors who are coming from American-based, UK certified. So we are dealing with the high-end professionals every now and then. And it is a very welcoming market by comparing to the Saudi or Kuwait or any other Middle East countries. Whenever we talk about the UAE, Dubai is the most prominent place. Everyone are welcoming, and it is very easy to live in. And you can see everywhere when we work with Dubai healthcare sector, it is very high qualified people, highly professionals, and we feel that we are valued and we are interacting with every now and then with the highly professional people. Even for the CEO sectors, also I'm having many CEOs who are coming from the Max, Potters, Apollo, and with diversified understanding of medical knowledge, and they come and implement the best practices in the UAE healthcare sector. So UAE is a very welcoming place where we are bringing most advanced high-end professionals from any other places, even from the Holland. Poland, I am having the doctors. Even the UAE nationals are also now educated. So the government is giving a lot of programs for the locals also to go and educate from the UK or Canadian board and everywhere, and they're giving the incentives also. But at this moment, the expatriates are ruling the market actually, very high-end functions sitting in the hospitals. This is the overall idea, understanding of the scene of the UAE healthcare sector. And here, what is the research uniqueness in my study is This study brings a distinctive and comprehensive addressing employee retention challenges in UAE sector, while previous research has explored personal interventions in general terms. The research delves deeper by examining the multidimensional impact of PDI on wide range of organizational outcomes, including succession planning, employee productivity, job security, organization commitment, compensation benefits, employee engagement, employee motivation, and trust in the organization. The integration of these diverse variables provides a holistic view of how PDI influence not just individual performance, but overall organizational stability. What sets this study apart as its focus on the healthcare context of the UAE, a region where demographic diversity and workforce dynamic differ significantly from global patterns by incorporating demographic factors such as gender, age, income level, and marital status. The study addresses a critical gap in existing literature and provides a more inclusive understanding of retention drivers in multicultural workforce. This demographic lens allows for the development of tailored and equitable retention strategies. Furthermore, the study's alignment with UAE's Vision 2030 adds another layer of relevance. Unlike existing research, this study situates its findings within the national agenda, emphasize how PDIs can contribute to the Vision 2030 goals of building a sustainable, efficient, and skilled healthcare workforce. This makes the research not only academically valuable, but also strategically significant for policymakers and healthcare leaders aiming to meet future demands. In essence, this study uniqueness lies in its integrated framework, context-specific focus, and its policy-aligned orientation, making it a pioneer effort in advancing workforce development strategies in UAE's evolving healthcare landscape. Thank you.
I also welcome Dr. Sushmita Mukherjee from IIT Kharagpur. Madam, are you audible? Am I audible, madam?
Yes, you're audible. Please continue.
Yeah, yes. Thank you, ma'am. Myself Meneka. I started the session actually with all your presence. Thank you for joining. So here I'm talking about research uniqueness. Basically, in the healthcare sector, why we are having different type of multi experience. People are like, we are going to bring the best practices in the healthcare industry. So based upon each and everybody's knowledge, the Sheikh Sultan itself is saying that Dubai is one of the most healthcare hub where it is promoting for the medical value travel. So different places from different countries and other people are coming, and he wanted everything in the hi-fi capacity, in the five-star model. Even the hospitals are also equipped with like that. And we also feel, because we Indian, a long time years back, even 2 years back, when I knew of the hospital, here the hospital model is entirely different when compared to the UAE hospital. It's very ambient, five-star capacity, everyone are well spoken. So that type of professional development programs which we are giving, and we are empowered to give that particular program because it showcases the government as such. So each private organization is showcasing, and we are having that permission to give the best capacity and the training programs, and the people should be modulated accordingly when we deal with any of the patients. So that is how that is the 2030 goals which we are having, going to another boom like robotic science and all are coming up with. So we are inviting that up as the conference. So thank you. I am just moving on. So the critical issue in the healthcare employee retention is a major challenge globally. And where rapid sector growth increases demand for skilled professionals, government investments in Vision 2021, UAE government prioritize healthcare improvements through infrastructure development and strategical national plans. Impact of high turnover disrupts patient care and increases operational cost, places excessive burden on existing staff, reducing service quality and stability. Professional development interventions as a solution, enhance employee skills, career progression, and job satisfaction. Improve both clinical and non-clinical capabilities, positively effective patient care, training in patient safety and quality of care, reduces turnover intentions. Job satisfaction and organization commitment, PDI, increase engagement, loyalty, and career stability. Stable workforce enhances team cohesion and overall healthcare service quality. Diverse healthcare focus workforce in UAE, composed of Emirati nationals and expatriates from multiple backgrounds. PDI must be inclusive and culturally adaptable to ensure engagement, career advancement, and retention. Structured PDIs create pathways for specialization and leadership. Employees perceive growth opportunities leading to long-term retention. Succession planning and leadership development identifies and prepares high potential employees for critical roles, reduces disruption due to leadership, turnover, and maintains healthcare standards. The impact of productivity and organization commitment. Employees engaged in PDI demonstrate higher and accuracy in patient care. Job security reduces stress and enhances commitment. Organization investing in PDI create a trust-based culture, fostering engagement. Demographic considerations, factors like gender, age, income, and marital status influence retention strategies. Customized PDIs accommodate diverse employee needs, ensuring long-term commitment. So what is the problem statement? Employee retention in UAE healthcare sector. High turnover rates among healthcare professionals are disrupting patient care and organizational efficiency. Depends on expatriate workforce 70 to 80%, creates sustainability and retention challenges. Frequent staff departures increase workload on remaining employees, leading to burnout and dissatisfaction. Significant financial burden due to continuous recruitment, onboarding, and training process. Healthcare facilities struggle to maintain operational efficiency and leverage advanced infrastructure effectively. So what is the impact on the UAE healthcare system? Disruptions in patient-provider relationship, reduce compliance and affect treatment effectiveness. Inconsistent care delivery due to staff changes can result in delays in diagnosis and lower patient satisfaction. High turnover prevents full utilization of healthcare technology as new staff require adaptation of time. Policymakers and administrators face increased pressure to balance healthcare service delivery with workforce management. Long-term instability in workforce retention threatens the UAE's vision of globally competitive healthcare sector. So the problem statement, employee retention challenges in UAE healthcare. High turnover disrupts continuity of care, increases reduced job satisfaction. Impact on patient care and healthcare.
Why are people leaving there?
So there are
impacts of the doctors or somebody there's healthcare relief, frequently. Then there are also adverse impacts at all. And then the research topic says that if you do something about the career progression, you will not be.
absolutely.
First of all, let us know why are they leaving.
There are different parameters for employees' point of mind. So let me complete the presentation and then I'll come back to
reading.
Yes.
You're only reading.
Yeah.
So it's the Meneka, like you have chosen a tool. There are many ways of monitoring the professionals for the employees, high salary, relations. You choose a tool to look after their careers of career.
Yes.
So it is you are doing a reverse engineering. So already selected a tool which may not be required unless people understand why they are leaving.
So when we look into the UAE healthcare market, there are different parameters available. For example, if an employee, the government employees, okay, in my organization also.
Do you have this slide why they are leaving?
Yes, I am having it.
Just show this.
Yeah. So let me go through that because there is a flow. So I will continue that and then I'll come back, sir. Yes, thanks. I'm just running through the points. Impact on patient care and healthcare. Official staff turnover weakens patient-provider relationship, delays diagnosis, and lower healthcare outcomes. Financial operational burdens, recruitment, training costs, and workforce restriction hinder efficiency and infrastructure utilization. Multinational workforce complexity, cultural, social, and economic factors affect job satisfaction and long-term commitment. Steady focus on the professional development interventions. Examines PDA impact on succession planning, employee productivity, job security, and more. Strategic insights for sustainable workforce management, identify key factors influencing retention and aligns with the UAE healthcare growth strategies. So what is the research gap is like? Limited understanding of India in the healthcare, lack of insights into how professional development impact healthcare organization in the UAE, the region's unique social, cultural, and economic factors, insufficient focus on retention factors, the influence of PDA on retention aspects, like job security, organization commitment, and employee engagement remains underexplored in the UAE high turnover healthcare sector. Overlooked demographic influences, the role of factors like gender, age, income, and marital status in shaping employee retention within UAE healthcare remains inadequately studied. Lack of integration with national goals, there is limited research linking PDI and retention strategies to UAE national healthcare objectives such as Vision 2021 and Sentinel 2071. Need for holistic approach. Yeah. Okay, ma'am. Need for a holistic approach. Existing studies often overlook the combined impact of factors like succession planning and compensation benefits on employee retention, necessitating a more integrated research approach. So the scope of the study, the scope of the study limited to the UAE healthcare professionals. The key region covered are as follows: Dubai, Abu Dhabi, Sharjah, and Ajman. The review of the literature. So there are different relationship between the professional development intervention and succession planning. Here, there are different type of literatures have been happening in different healthcare sector, oil and gas, tech industry, family-owned business. The key findings are research shows that structured professional activities, including leadership training and significant boost succession planning, effectiveness by readying internal candidates for leadership roles. Research has shown that organizations that combine professional development interventions with succession planning experience higher rate of internal promotions and more seamless transition in leadership. The importance of mentorship and leadership training in succession planning has been emphasized. Employees who participated in the PDI were more inclined to take on leadership positions. There is another study which has come up with highlighted the growing necessity of formal professional development interventions to equip the upcoming generation of leaders in family business, thereby ensuring sustainable leadership for the long term. Targeted training programs were found efficiency and improve the quality of the patient care. The education industry, there was another research which has come up with ongoing training has been shown to correlate with 115% increase in both task efficiency and job satisfaction. There have been notable improvements in task accuracy, speed, resulting in 25% increase in productivity. Research indicated that training in soft skills improved team communication and resulted in a 12% increase in overall productivity. There was an oil and gas industry. There was a write-up showing it was concluded that leadership PDI improved team dynamics and led to a 10% of increase in staff productivity. So in the service organization, there is a consistent participation in the PDI, perception of job security and decrease in the turnover, 25%. Employees who participated in PDI reported feeling more secure and motivated, which led to improved retention rates. It was reported that leadership PDI greatly enhanced employees' feeling of job security and their commitment to the organization. There is a write-up about the healthcare workers participating in state PDI reported a 20% of greater perception of job security compared to those in the control group. In the tourism level, yes, research found that PDI played a crucial role in maintaining employees' perception of job security during times of economic uncertainty by providing opportunities for upscaling. There is for the in the healthcare sector, research indicates that PDI aimed at greatly improve both organization and the satisfaction among healthcare professionals. Continuous PDI, particularly skills training, resulted in 20% boost in organization commitment and a decrease in turnover rates among nurses. In the education industry, there was a write-up stating it was highlighted that training in soft skills and professional development interventions for leadership that have led to increased organization loyalty and commitment, which in turn has improved employee retention. It was reported that both technical and interpersonal professional development interventions enhanced job satisfaction, which in turn led to a greater level of organization commitment among employees. In the healthcare, research indicates that PDA focus on both professional and personal development that enhance employee engagement and commitment, resulting in improved retention rates. There are some service firms. The research indicated that PDA improvement resulting in increased salaries and the related incentives. Pharmaceutical. Yes. Yeah. So then there is a pharmaceutical company. It has been shown that ongoing training associated with compensation enhances job satisfaction and employee retention. There was an increase in employee engagement while professional development interventions were linked to the compensation benefits. So basically, there are different type of literatures that come up in the industry, which has shown about the employee satisfaction, how the employees are continuing with the organization. If there is no particular motivation for the employees, how they are doing stagnant in their particular role, there will be no sort of interest to continue with that particular organization. So in such cases, if the employees, if the organization is not giving such a platform for the employees to come and develop, for example, the person is joining the customer service role, and that contract is 2 years, he is still continuing with the customer service role, and after the day, the person is more aggressive and he is very competent enough, and we are not giving a platform for that employee to grow up, then he will feel that, okay, I'm stagnant, I'm not getting a career opportunity, or I'm not going to the next supervisory role or senior executive role. He'll automatically come up with a non-renewal letter and he will look for a new job. So probably he is more intended for the career development program. That means if we give some sort of techniques or give some sort of training programs and everything, the person will have gained that knowledge and capacity and will go to the next senior executive level. Yes.
Right, what is new?
Yeah, so
What is the new on this?
that is what
Not in India, also we are facing the same thing.
Yeah.
PDI, you are telling PDI, so many of this. So universal phenomenon, and world also this things will happen.
Yeah, it is a universal phenomenon.
That's what I want to say. In this.
Yeah, so the uniqueness, what I meant to say is, especially in the healthcare sector, organization when we are focusing, here in UAE, the most focused sector is the hospital and healthcare industry. It's not like in India, it's a bigger platform. More lot of education industries, the factories, and all are there. But basically, in the UAE healthcare sector, the main focus is for the medical tourism, hospital industry, healthcare, education industry, oil and gas. So these are the main areas where the visionary leaders are more concentrating on the healthcare sector. So where in which we are not only getting and moreover, the local employees, that means UAE nationals are not that much of educated and skilled enough. Nowadays, yes, government is giving the platforms, but the people are coming from the different industries. So we need to help them to retain in the industry, in the hospital, and continue with the organization. That's how it is. That is why there are different types of surveys from information technology, notably increases in engagement and enthusiasm for work have been observed as a result of the flexible PDA programs. So the research methodology is like this chapter serves as the methodological foundation of the research, outlining the systematic approach undertaken to examine the impact of professional development interventions on talent retention in the healthcare sector. The study aims to explore the relationship between the PDI and various factors such as succession planning, employee productivity, job security, organization commitment, compensation and benefits, employee engagement, motivation and trust, which in turn influence employee retention. This methodology encompasses various critical components, including research questions like objectives, variables, hypothesis, data collection methods, and statistical analysis techniques. So here, we are trying to approach undertaken to examine the PTI on talent retention in the healthcare sector, and these are the factors, PDI and various factors like SP, like succession planning, employee productivity, job security, organization commitment, compensation and benefit, employee engagement, motivation and trust, which in turn influence the employee retention. To execute this research, a cross-sectional research design has been thoughtfully adopted. The research questions are like, how do professional development interventions impact key organizational outcomes in healthcare organization in the UAE, such as SP, employee productivity, job security, organization commitment, compensation benefits, employee engagement, employee motivation, and trust onwards the organization. What is the combined effect of these organizational outcomes on employee retention in healthcare organization in the UAE? How do demographically factors like gender, age, income level, marital status influence employee retention in the context of the UAE healthcare sector? So these are the research objectives.
How do you measure this? Last two slides.
Yeah.
You have shown so many things.
Yes.
How do you measure this?
Yeah, the measurement model I have come up with the I'm having the exploratory nature and the cross-sectional has been adapted. So I'm just going through this, how we have come up with the research objectives and all those. The research objectives are like
How do you measure that? You have measured motivation, you have measured conflict, you have measured so
yes.
trust.
Yes.
What is the tool that you have?
See, my study is
the question that you have shown. You have shown so many questions. Go to previous slides. Previous slides. This was the so many things. How do you measure this? you have taken to motivation.
Yeah.
And trust. And what you have got?
Sir, the measurement modelers have come up in the next slides. So let me go through that and then I'll come back, sir.
No, please show me.
Yeah.
Please show me that. And what you have measured, how you have measured.
Yes. These are the
These are the
hypotheses.
hypotheses.
Yeah, these are hypotheses. Yeah. And these are the organizational variables. Yeah, organizational variables. Descriptive model, quantitative, and the cross-sectional. So in the cross-sectional, a cross-sectional design allows us to capture a snapshot of employee perception of work-related factors at a specific moment of time. And descriptive model provides as an in-depth understanding of the impact of ADI. The tool I have used. This is a sample size determination. Okay. These are the data collections, measures of variables. So I have conducted the pilot test set. Yeah, yes, sir, because the slide is not moving. Is get lagging. Yes, the normality table, wherein is the yeah. Yeah, I'm just going on with that. Yes,
You see, even done the research.
yes,
There is nobody on earth who know more than people.
yes,
And people like me will come in the civil. We are much more ignorant than you.
yeah, sure.
So how do we test you? But we judge it, it's not like a normal person. So PhD is student. But 22 or 21 is registration was done in which year? 19.
2019.
We spent good 6 years on this.
Yes,
Definitely, every supervisor will not know at your table. There's some people like us stuff, this stuff, and police. How do we test you? There's some problems.
yeah,
So you will keep doing blah blah blah, then finally you come to a crossroad.
yeah,
So there I will check you to okay. But I cannot catch you anything. Catch you only at the crossroads.
yes,
Like if there's now a question with plus question, when you are saying find such is I can say. And that's how we give you marks, accept your this is what you accept.
yes,
Because we know that we have done the research.
yes,
I have not done, he has not done research.
yeah,
On this particular topic, you are the wisest. So help us
yeah,
to understand what you were saying. You help us to understand our, then you will get a complete.
yes, yes,
If you don't help us, you are trying to just, as it is there, confused, we do not know the thing.
yeah, yeah,
Maybe somebody has just studied you the basis.
Mhm.
But then it took work of 6 years of study. To help us to do that. Otherwise, we will get you only at the cross points.
yes, yes, yeah,
Then you will have problem. To explain us, it's something like we are sitting in a class. What was the problem like that? If the whole topic was there, yes, the universal problem, that's why reason. But it is so, I can count 5, 6, he can add another 5, 6,
yes, yes.
7, 8.
Of course, yeah, the variables can be here and there, yeah.
Every organization, typically, right, won't take the same.
Yeah, the comfortable and they will sit in the comfort zone.
So, but it's
It's
so,
like that.
like you said that, something about peculiarities or uniqueness of the health sector.
Yeah.
Okay. Now tell me the uniqueness of that sector in UAE, why the employees would apply your scheme.
Yes, yeah,
That we should know,
yeah,
then you are not help us by others.
yes,
So our 10, 12, there is some prominent research levels in very
Absolutely.
unique to UAE,
Yeah.
right there. Then there are mitigation techniques again, and you said by way, by circle and another 10.
Yeah.
So there are 20, 25 techniques how to do that.
yeah,
Out of those 20, 25 tools you have chosen one to
yeah,
that is children. Why have you chosen?
yes, yeah,
So that means the presentation must proceed like this.
yeah,
If these are the reasons.
The flow.
If this is the most prominent reason.
yes,
And therefore, This is the most effective tool. There are so many tools, but
Yes,
it's not that very effective.
yes.
Okay, so when you go, we get convinced, yes, you are right. So then you start using that.
Yeah.
And then what is the impact coming onto that? Measure that.
Yes.
So all those things, that is what we are looking for.
Yeah, absolutely, yes, sir.
Rest, all is written in your thesis.
Yes, it is better, yes.
And definitely, even if I read this, anybody reads, we can understand only on a very superficial level. That's why we are able to respond from Bangalore here.
Yeah, I think that, yes.
Clearly. So explain us those things very clearly. Otherwise, I can tell you how you are measured it.
Yeah,
I'm not finding the interlink between this.
yes, I understand because.
So many things are there.
Yeah,
So, you will easily understand what you have done.
yes,
So better grade that you get.
okay. See, sir, what tool now? For example, when I conducted this particular study topic, I've noticed that most of the complex, my data, when I conducted this data analysis and everything, my data is like complex model. Actually, there are a lot of variables on here, and it's a very complex in nature. So I have gone for this smart heuristic. So I have adapted for this particular study. Also, have come up with there are three type of theories I have adapted, wherein which I can explain that to you.
This is the testing.
Yeah, this is the testing part, but I have taken the.
Something question that's
I have.
those are these very critical questions.
Yeah, I have come up with a study. Also, have adapted with the theories. Yes, this is the theoretical background. I've adapted three theories for this particular study. One is the social exchange theory. There are different type of theories as
Shall I
well.
want to that?
Yeah. So,
See, there is a patient.
yes,
First diagnose क्या है उसकी बीमारी की.
yes,
So can it be treated like this? Can it be treated like this? There's so many paracetamol.
yeah, there are different
There
combinations.
is possible. And then we choose to treat from that, depending upon the symptoms and all those things. I want to know why have you chosen this method?
Yes. So why? Because there are different type of theories are available for this particular study.
I have chosen this, then I will get into it. And I
Yeah.
will open a book to read what is in solved.
Yes.
First of all, why should I open this book at all?
Okay.
Because the easiest thing is that uska survey kara. That's what we all do. Usko note kar do. Now you tell me like some doctor is a super specialist. इसके career की क्या progression करने वाले हैं?
Yeah.
Tell me, are you aware?
Yes, yes.
Are you a doctor?
Yeah. So if I am the gynecologist and if I look for only for the gynecological methods, then I will not be able to sustain that history. I need to have that gynecology laparoscopic skills, the very complex model of the aesthetic side of it. Plus, I can handle a very different high-end model of surgeries, which can sustain the patient from the complex critical illness and save the patient life. So I need to enhance my skill in such a level, not only in the MS gynecology, which I will not sustain in the healthcare market, is very competitive. If I want to demand a salary also from the employer will not go going to be paid. Because it's obviously my law.
Yeah, so this question you have to very
Yeah.
clear. So before that, are you going to leave that hospital?
Yeah.
Because you don't have a particular set of skill. Or will you leave the hospital because of other? What would be
There
your
are two
reason?
type of patterns. For example, if the person is really skilled enough and the organization.
No, you see, so there is research. There is more. So my first part is that it's a universal problem that good employees. That's why the DRS has failed everywhere.
Yes,
Because DRS is designed for all those people who want to get rid of the rut which is there in the organization.
yeah,
वो नहीं जाएगा. वो अच्छा है वो DRS लेके चले जाए.
yeah, absolutely. They will get the best.
So those reasons are well known. Period is in health sector. And that particular reason in Dubai that we must not say no to. What we have heard is everybody wants to go to Dubai. आपको क्या पता है कि दुबई से वो भाग जाता है? हो सकता है there must be some very peculiar reason.
Yes.
तो आप कहाँ जाएंगे? इंडिया तो आएगा, तो पैसा मिलेगा ही.
Yeah.
Very simply, if you go to the US where once though the pattern one is there, then उसका treatment क्या होगा? This could be a treatment. Maybe that this is no treatment at all. You are he is having. Hello. Yes. Yes, yes, sir. So you are assuming that this is the one treatment which is going to treat.
See, sir, when we talk about the UAE healthcare sector, it's not only one particular point that employees do. There are different variables about our it. Yeah.
Work there. Also share, this I can send video.
Exactly. Yes. Yeah. Yes, so there are different methods are there. And for example, there is, I mean, suppose if a person is working in Apollo. The Apollo doctor is moving, I'm just taking to make my understand.
So that is what was the research here. Now we are speculating. At least a good portion of the research ये जा क्यों रहे हैं? Only then तो treatment आएगा.
Yes, yes. So.
दवाई बाद में आएगी.
Now,
But the cancer is not coming.
yes, so in UAE healthcare sector, what will happen is we are having all sorts of corporate policies, formations and everything are there. But if the policies and setups are there and but it is not given properly to the employees to come up to that particular level, there will be a big distance between, a gap between the leadership level as well as the employees level. There are different level of low level is there, middle level is there, and upper level strategic people are there in any professional goals. So in any organization, if we are not bringing a proper treatment or the considering the low level employees to rise up to the middle level. Yeah. We are looking for the, in my study have taken for the doctors, nurses, technicians, accounts, finance, all these levels of categories. They are not actually. Yeah, our doctors will be having a different doctors and as a non-doctors capacity are also having a different reasons. So basically, we need to know the doctors, yes, it's more of a technical type of one, but for the customer service, accounts, finance and all are having different type of mindset.
So what sir said, it is very generic. So what sir would like to work this time? All of us would like to waste all this. So specific about.
Or if you are not go to the research work,
Yeah.
where somebody else has done the research on this and he has found out the reasons. And then you take his results and I am starting from. Because he has found out that primary reason in Dubai, in health sector, why well qualified, good doctors are leaving is that they do not have a chance to get it. So this is a work done by state. Maybe 5 years back, something like that. I have studied and it has generally been accepted. So I quote you, thank you, and then I further do the research on how to mitigate that problem. And I think that problem can be mitigated with others. That's the starting point.
Yes.
So either you take his your first literature services to say कि हाँ research हो गया है, so I am not doing it, but then you will accept it.
Yeah.
But he has done that.
Absolutely.
Has somebody done that?
In my research, there are different type of researchers were there. That is why I have quoted, there are previous researchers were there, but it was not properly completed with the complete outcome of the partial development interventions in retaining the employees in the healthcare. It is not conducted the complete model.
Yes, for example, I mean, in the Arab world, you said 70-80% are expired.
Yes.
So are the Marathis and the expired treatment? In all respects.
Not in the start.
Okay. Is there a prospect of pasta?
There is, because that pasta is not allowed in the account.
But as far as I know, is that pasta? That's a factor of the other problem. In some form or the other, pasta is applicable for the other. And that impacts the nature of emphasis of the
In UAE, especially the UAE healthcare culture, basically the public sector is also there, private sector is also. In the public sector, most of the
Because somebody is there also.
yes. So yeah, sorry. It is like most of the people who are in,
Also that we can also get.
yes. So most of the it's a public sector as well as the private sector. So in the public sector, the majority of the government-related hospitals, we are having the high-end specialists who are sitting like consultants and the professionals. They are from the UK board or American board certified people.
If I go back to the same.
Yes.
There are these experts. Are they treated same?
They are not.
What's the difference?
So the difference is only because the people are, if we consider the public sector, the HODs, the high-end specialty departments, doctors are the consultant board, and they are the UAE nationals or the Arabic speaking people, but they are highly educated from the Canada or American board or UK board. So they base that professional capacity. So they are the head of the department in the public sector.
So what are the differences? Are these differences the reason because of which experts?
So now, for example, when we talk about the government of UAE, we are having a lot of private hospitals are also established. Very high-end specialized private hospitals are there, wherein which it has been owned by the private-owned parties, like expatriates. In that expatriates group, where we will get the high-end specialized private treatments, everything is available. And majorly, the private sector hospitals, expatriates are working. The people are from different communities, like from India, Pakistan. We can get from the Syria, Egypt, Lebanon, highly specialized doctors, and even from the business development capacity, even the CEO board capacity, all are from the expatriates level. So if the people are moving now, for example, my movement of the CEO capacity from one particular private organization, I am going and moving to the high-end, another high-end, even the private capacity are also under different levels there. So there are Cleveland is there, Cleveland Hospital is there, there are John Hopkins hospitals are there. So the people are also moving from one level to higher level and hospitals private capacity based upon different matters. Might be because of the culture, because of the professional development, because of the platform they are getting, might be the inclusiveness for the employees. So these are the areas which
service. How do you reach this conclusion saying that career progression would be the right intervention to stop this kind of say expatriates leaving?
yeah, the reason, one of the reasons is like many of the private healthcare sector, I'm not talking about the public sector, many of the private healthcare sector, if the employees are not getting the proper training programs, they will not get any sort of career progression, and they submit the resignation and they move on to another employer, not only because of the salary, because they are not getting the career progression in that area, or they are not upskilled. So that is one of the main reasons which we have focused. I am having many of the HR who are also sitting with many of the
If I ask you
hospitals.
one question,
Yeah.
the person is not capable enough. Do you think that the person who is interviewing you, he will take?
Sorry.
If he's not capable.
Yeah.
He wants to leave, get rid of the job.
Yeah.
He'll apply, he'll go somewhere. You think the person who will interview, he will take you.
See, if the person.
Now, HR is adding values.
Yes, of
Right?
course, yeah.
It's not the earlier days.
Yeah.
Do you think that the person those who are interviewing their fools?
See, now the HR is.
Can anybody make fool on their expertise? If you are going to interview somebody, can you take him?
No, I can
Empowerment is something different.
incorporate in something
Your study
different.
is something different.
Yeah, so why I have come up with this particular topic is like, now the job demand rule is also a very different topic, actually. In the job demand rule is also there for us. Now, for example, job demand resources. Now, for example, in many of the hospitals in the healthcare organization, we are implementing the HRI system, ERP model, AI interface and everything. So they are contributing more into the organization in the capital model system. So if we give the proper training program for the employees are also benefiting and the organization is also benefiting in turn.
I was telling what to do. See, like the rates, they are expatriates. We know there are rules. There may be a number of reasons why people are. One of the reasons will be that I have not been treated well. I am not at par in America. So everything she has done, she must structure her presentation.
So she has the demographic profiling also when
Yes,
You do now, in the life because we want to know that why she has chosen this section. Now, I said that somebody has already researched and he has already found it. We have some other story. Or if it is established fact, अगर ऐसा है, if you want to know that, it's the main reason where high professionals, they want to stick to the blame. Then they think. Having done that, so that first question was to be answered very clearly. So, if that is established, then what is the remedy? So the remedy is that you have to design certain career progression. So now the research starts. So thereafter, how many people are there? Such people who require what kind of career progression you, what kind of career progression that can be given there. You have this system that you still need the study like we had studied about now. So they get their salary, the investors from the opportunity or so progress all those things and they are if you are making this, I can see there are about 17, 18 hypotheses. Those hypotheses are they just like yes for certain because it's a two-way process. So I data that you get like this. This is just not out of the way. Just to say it. So you come here, do observation. It's bad. It's bad and not working. This does not be attended to stop. Leave the customer. The first evidence is there. And then I test whether the ask for people to get data. Interested. Don't know. Then you
the object is for every object can be questioned.
that's what I'm saying. So you cannot write any objective just like that. That's what I'm saying. It looks like a classroom. Yes, suppose I am teaching how to do a research service. So you do research or now you make objective. You write any objective and then prove it. So that is methodology. Now here, each objective function, why have you made this objective? Will be questioned. Because if you make wrong objective functions, your research will focus. Take time. Reorient the research. She has done lots of work and she has to explain. You cannot everything the best of the student are writing in there and they don't give you more than 40-45 minutes and the whole thing is over. You cannot have like this, these are this is the written on slide. You have to tell the crux, as you are saying. We are not experts. She is the greatest expert there are at you because you will guide it. And then you come and explain to us, this is the problem. So what can you do? This, we have done this. And if we want to take because we are wise guys, but not informed on this topic. समझ गए तो उसको बाद हम लोग 15 मिनट्स 30 मिनट्स मैक्सिमम 45 मिनट्स तक प्रेजेंटेशन कर लो so happens in Indian Institute of Science IIT everything because इसके पहले 4-5 प्रेजेंटेशन हो रखी है वो that is either earlier the thing has not been done और आजकल ऑनलाइन चला हुआ है उसमें आप लोगों ने सब चीज कर करा दिया होगा तो let's give it time let's have a couple of reorient select the slides for this and send are you getting what I'm saying? There is a logical way of proceeding and answering those questions. How she has tested, we all know those are the T tester, C tester, Corona tester. Oh, they are numbers. They are different features. You show the data was same. By looking at the data, it will tell you कि हाँ ये hypothesis true होने जा रहा है या false होने जा रहा है. Experience. इसको थोड़ा नहीं and she's come all the way. Plus the presentation. How many slides you have got to?
We've got almost like 70 slides.
कितना?
70 slides, but I will not go through all the slides actually. I will go through the main points only. Yeah.
15,
I'm not going to explain all the slides because I just want to know.
Because by time and again we are trying to put you on the rail. ये track ऐसे चल. They're not coming on. उस process को reorient करो. Give it a break. I think sir वहाँ और sweetie. The London to sir वो is also free. And the question. But reoriented. देखिए better है वो करा चुके. Very limited questions that we have to answer. Now, ये है, कौन है, कैसे है? Then you, I know that she will know how to test it.
Yeah, I know with all the variables based upon the settings. Yes, I understand that.
Maybe one hour by now.
Sir is asking, yes.
Yes, madam.
Can we take a break or something?
Yes, please.
Okay, take a break and then you read it because we want to give a chance. This is not the way to go. That tell everybody. We know your thesis, all the externals, everybody has they've seen today thesis got presented to everyone. One bring it here. The thesis will be kept here. There is no doubt to open the
She is the lost student here because of the day and his.
No.
And it's okay because I understand that because I am also coming from all the day. I am celebrating it.
Thereafter will be a PhD talk. So PhD is the last degree in that category. You yourself will become a guide. Yourself become an expert. So should be able to know about things. It's not just like this.
Yeah.
And it is a research. You cannot afford to make statements like this. It will be like this because if this statement question, why you say like this? We are not politicians. Make a statement, get away with it. The moment you make a statement, will be challenged. Prove.
Alright, sure, sir.
So that's how we research
I'll just
goes.
collate this and then,
Yeah,
of course, I understand what exactly sir is asking.
And please request your research from my humble request to research from you will tell us.
After 15 minutes.
Yeah, sure, sure.
Madam,
Take your time.
Yes.
Madam Sushmita. Madam, are you there? Madam. Madam said,
Stop share.
Stop.
So I have already sent you the viva questions. Can you answer those? Have you prepared your reply for those?
Madam, if you are not okay, ma'am, you can please leave. Your voice is not appearing
No,
good
no,
to us.
what I'm telling, like I have already sent her the viva questions.
Okay,
In
ma'am, I'll
questions.
take care of that. We'll try to answer it in the next session that is scheduled after just 15 minutes, ma'am. The panel has asked her to reorient the slides, so would be doing that. And ma'am would be answering the questions.
Yeah, so how much time will you take?
It will take, ma'am, not more than 15 minutes, ma'am.
Okay. So, would we rejoin the meeting?
Yes, ma'am, kindly rejoin the meeting. After 15-20 minutes. I'll call you, ma'am.
Okay. See, one thing I'll tell you, even in her research, I've made a comment on that. She has done too many things, okay? Let her to focus only on the main thing that she has done, okay? So many variables, so many outcomes. It's all very a huge thing. But out of that huge thing, what is that thing what she has done? Okay, so many independent variables, so many dependent variables. Somewhere the flow is getting lost. Okay,
Yes,
so
ma'am,
while
we
you're
understand that. Yes, ma'am, we understand that.
reorienting your slides, please keep that in mind and do it.
Okay, ma'am, surely.